Good afternoon, everyone. Thank you very, very much for joining our virtual training, basic training in care of the elderly. My name is Dr. Mrs. Mininim Oseji, Mini for short, and I'm the Executive Director of Public Health Impact Research Center, as well as the Medical Director of Berachah Community Clinic. And I am delighted to welcome you to this event. The program has been shared in the chat box, and it goes as follows. We have welcome remarks by myself, followed by the presentation on basic training in caring for senior citizens and vulnerable people at home by Nene Ubibi Modi. And then we're going to have question and answers, and then closing and next steps by myself. It's going to be very, very interactive. And from the time we're starting, we don't intend to stay longer than 90 minutes because many of us who are participating here are actually 50 and above. So even this training that we are having is actually something like adult education. So as much as possible, we want a situation where we don't stress ourselves. We'll be able to retain as much as possible. And then we'll focus on the actions we need to take. In my line of work and the kind of things I do, there is a lot of training and orientation going on. And from findings of monitoring and evaluation, we discovered that very little is being retained because of the way we go about the training. So we're hoping that our innovative way of training today is going to create maximum impact, maximum retention. And without further ado, I am going to present the welcome remarks. It gives me great pleasure to welcome you to this virtual basic training in care of the elderly, organized by Public Health Impact Research Center in collaboration with Eoon Care Services, as well as Berachah Community Clinic. Public Health Impact Research Center is a research-based non-governmental organization founded in June 2002 and dedicated to the promotion of the health of the public in Nigeria and Africa. Berachah Community Clinic Asaba was established in April 2014 to provide the following services: outpatient consultation, immunization, screening for cancer of the breast and cervix, as well as prostate, HIV counseling and testing, occupational health services, home-based care, medical outreaches, as well as telemedicine services. A senior citizen center for persons who are 60 years and above was officially opened by Berachah Community Clinic on Saturday, 1st July 2023, with the hope of contributing to filling the gaps identified in providing health and other social services for our senior citizens in Asaba, the capital of Delta State of Nigeria. The center is specially prepared to provide relaxation, socialization, information, and care of senior citizens through well-being talks, games, arts and crafts, book reading, film viewing, periodic free medical care, and lots more. The time of operation is every Friday from 9 a.m. to 5 p.m. Registration for membership is free, and members are encouraged to come with another senior citizen to make their experience more interesting. We also have a library where books can be read and various literary activities organized. This particular training being organized today was born out of the need to ensure that those who care for our elderly are given some basic training. We don't want a situation where people come from rural areas, people who are not educated, and for want of a better means of livelihood, all they can do is to be a housekeeper or a carer of somebody who is elderly. Now, if they are going to take care of our elderly who have worked so hard to bring us up, give birth to us, nurture us to become who we are, our elderly deserve to get the best of care. And there should be minimum standard of the person who is going to take care of our elderly. This is why we have made this training free. Otherwise, some people have paid very large sums to receive this particular training. We're also recording the training so that those who are not able to participate can have access to it. And then if one is recruiting somebody to care for the elderly in their household, they will be able to go through the video recording with that carer and ensure that basic understanding of do's and don'ts in the caring of the elderly are transferred, the knowledge is transferred, the information is absorbed, and hopefully with time, there will be increase in proficiency in caring for the elderly. The elderly in Nigeria and beyond, they are worth having the best of care, and this is our contribution to making it a reality. On this note, I wish to thank you all for honoring our invitation and contributing to make this training a success. Thank you and God bless. I'm Dr. Mrs. Mini Oseji, the Executive Director, Public Health Impact Research Center, and the Medical Director, Berachah Community Clinic. Thank you very much and God bless. On that note, I am going to switch off my camera so that I can focus on the network will not be fluctuating and I can focus on moderating. So as I switch off, I'm going to go on to the citation of our facilitator, whom I mentioned in the welcome address. Before she will come to give her presentation, which is going to be very, very interactive.
What do you mean by?
I'm trying to share the slides so that once I finish, she can just go ahead. So I'm just trying to share the slides. Just bear with me.
I think I'm sharing the slides now.
Okay. Oh, that's
Can
fantastic.
you see?
Please.
Yes.
Yes, go ahead and share the slide then. All
Yes,
right. You already
I'm
have
sharing
it.
the
Oh,
slides now.
very good. Okay. So let me go ahead with the citation of our facilitator. I will start from the Eoon Care. Eoon Care is the leading provider of health and social services dedicated to enhancing the quality of life for elderly individuals and their families. With a presence in both Nigeria and the United Kingdom, Eoon Care focuses on elder care, family bonding, and empowering caregivers with knowledge and tools for better support. Their commitment to compassion, dignity, and evidence-based care has made a lasting impact on communities across borders. Eoon Care was founded by Nene Obibimodi our facilitator, a highly skilled registered nurse with extensive experience in adult and community health, with a vision to bridge the gap in elder care between Africa and the United Kingdom. Nene has championed awareness, education, and accessible services for families, navigating the challenges of aging care. Under her leadership, Eoon Care continues to be a beacon of support and advocacy, ensuring that no elderly person is left behind and that caregivers are empowered every step of the way. Ladies and gentlemen, it is my delight and honor to welcome Nene Obibi Modi to go ahead and give her presentation. Thank you, Madam.
Thank you very much. Thank you. Welcome everybody to this very basic training on caregiving for senior citizens and vulnerable people. I would say that anytime you hear the word elderly, you just know that it's also referring to senior citizens. This session is designed for caregivers, family members, and anyone interested in caring for the elderly and vulnerable people at home. Caring for elderly people is quite tasking, but it's a privilege as people age around us that we participate in their care as they have cared for us when we were younger. Okay. The key topics that we're going to cover today, the session is very interactive. So under each session, there will be activities for us to discuss or for you to raise or share your opinions and experience, because we want to learn from you as much as we're giving you information. The key topics today would be to understand elderly care needs. In this, we're looking at who the vulnerable person is, common challenges, and the role of a caregiver and family members. We're going to look at the essential principle for caregiving. We'll have a glance at what is called the UK Care Certificate Standard, which this whole session is based upon. We're looking at key principle of elderly care. We'll look at the core skills for caregivers that would make you safe at home. We would also look at the communication, what it is, being effective, and mental health support, because as we know in our society now, we have a lot of awareness on mental health. We'll look at record keeping and care planning. And finally, we'll look at what is ethical caregiving. So looking at things like the frauds and the abuse that elderly people sometimes suffer. So the learning outcomes, hopefully by the end of the session, you will have an improved confidence and knowledge in handling caregiver challenges. You would have learned practical ways to improve the quality of life for senior citizens, elderly people, and vulnerable people in your home, and understand how to balance caregiving responsibilities without experiencing that burnout associated with that whole mental health. So understanding, I would first go back to say that caregiving can be very, very overwhelming. But with the right knowledge and strategies, caregivers can promote better support. Many elderly people in our communities suffer neglect due to the lack of caregivers' knowledge. Falls, I'm sure if you haven't fallen, you may hear of somebody who has fallen. Poor hygiene, medication mismanagement, which often leads to hospitalization. Also, there is the emotional stress, loneliness, and depression, all from the lack of interaction that these vulnerable groups often have. So participation today in this session is very hands-on and is very interactive. So if I can ask everyone to have their microphones off, I will encourage you to use the chat box if you can, or you can raise your hand, and I can't really see the screens, but I have Flora assisting, and she will help identify if people need to ask questions. That's the best way to go. But please, I encourage you to actively participate, because that's the best way forward for us to get the maximum out of this 90-minute session. So we'll go to the first section, which is understanding vulnerable person. The term vulnerable person often refers to individuals aged from about 60 years and above. And these people often, when they're called vulnerable, they require assistance with daily activities due to physical, mental, or social challenges. They often need specialist care for conditions like arthritis. Maybe you might they might have a bit of hearing loss. They might have dementia. Dementia is one of those words now that are creeping up regularly within the Nigerian communities, and they might be frail. Some older adults live alone and lack family support, making them even more vulnerable to neglect and abuse and financial exploitation. Those are the people we would term as the vulnerable elderly persons. The common challenges are quite vast and are often either of their physical, mental health. So when we look at their physical health issues, aging leads to weakening bones. Reduced mobility is something we can find where, as we're getting older, we find it more and more difficult to move. And some chronic illnesses, unfortunately, as you get older, become worse, or you acquire them as you become older. An example is hypertension and diabetes. We know within the African community, many people we know, members of our family, already hypertensive, already diabetic. Other common challenges within the elderly care are the mental health and cognitive decline. We are no longer as agile as we wish to be, both physically and mentally. Many older adults experience memory loss, confusion, and dementia-related disorder. Emotional and social issues are also raising its head, as we find when people grow and they've had families, the families have grown, the families have moved on, and the families have gone on to have their own families. So what you tend to see is a lot of loneliness and depression are common in elderly people. They're left alone in their big houses or little houses to cater for themselves, especially those without regular family interactions. Nutritional challenges is also a big thing within the elderly care, because many elderly individuals struggle with proper nutrition, either due to the loss of appetite. As we get old and we're aging, our appetite reduces. There may be dental problems, and that can affect chewing. And difficulty and stamina in cooking, in standing up to prepare meals, especially the traditional ways in which they're used to preparing their meals. This can become challenging if they're not able to stand for long periods. And another challenge is the medication. Forgetting to take medication on time is a serious problem, and that often leads to the worsening condition. So we have people who have been prescribed medication, but have not remembered to take the medication. For example, you have people who have a minor infection, have been prescribed antibiotics, but have completely forgotten to adhere to the antibiotics regime for taking it, which means that the infection is going to reoccur. Most often is the case. So the role of the caregiver and family members in the elderly care needs. This often evolves around caregivers providing daily assistance, including things like personal care, like bathing the person, dressing them, feeding them, and supporting them for mobility. Okay, walking alongside them, making sure they don't fall and they actually get from A to B within the home. Emotional support is just as crucial as physical care. So companionship, especially as we talk about loneliness, companionship helps prevent loneliness and depression. So you often find if grandma or grandpa is constantly on their own 24 hours a day in the house, mentally that's not productive for them. That might lead to depression. So a caregiver must always observe changes in the elderly person's health and report concerns to either the doctor or family members. Providing a safe home environment by preventing falls and ensuring proper hygiene is a key part of care. So now, the first activity we've come across now is to share your experience. So we can discuss one challenge, or you can just mention a challenge faced in elderly care that you're aware of. So I'm asking you to share one challenge that's that you have observed in elderly care, either for yourself or for people you have cared for. And we have about maybe a minute or two to briefly go through this.
Are we supposed to write it in the chat?
The chat will be good, and then we can compile it. The chat, if people can use the chat, that would be much better.
Okay.
Or
They can raise their hands and they are called upon to speak?
Yes, or they can, I was going to say, they can raise their hand and they can just mention if a challenge they observed or they have experienced themselves. I can see one hand raised.
Okay. My name is Dr. Mininim Oseji, Mini for short. And one challenge I had when I was taking care of my elderly mom, my mom passed away at 89, 4 months before she clocked 90. So she was quite elderly. And it was complaints of different problems. And she used to complain that she couldn't sleep. So there was a particular time she visited me from Port Harcourt in Asaba, and she asked if I could get her sleeping tablets. And I said, why? She said she couldn't sleep. And then incidentally, it was her birthday shortly after, I think that very day. And so I got my 3 daughters and her housekeeper to enter a dancing competition. And so we sang songs, and then we made a special meal, and she ate, and everybody ate. And the person who won the dancing competition, which ended up being her housekeeper, got, I think, a drumstick. That was the prize for, winning and all that. So she had something special in her own meal and all that. And it was so much fun. And then my mom went to bed, and the morning I asked her, were you able to sleep? She said she slept like a baby. So I found out that the reason she used to have all those complaints, insomnia and all the other complaints, was because she was actually lonely. Everybody was, I go to work, the children go to school. She just cooped up with the housekeeper. Maybe they don't really have much in common to talk about. And when I come back, I'm just too tired to even engage in conversation. So I think that is something we need to know, that many times when elderly people are complaining of these symptoms, they are actually psychosomatic symptoms from loneliness, depression, things like that.
Yes. Yes. Thank you. Thank you for sharing. That's a classical example of, again, there was a problem and the solution was almost...
Solution was handy, it's not drugs.
Yes, indeed. Indeed. Moving exercise, because that dancing is actually exercise. Exercise. Any other hands?
We have some chats, some messages in the chat. Most people talking about mobility and loss of appetite, not wanting to eat and not wanting to take their meds.
Oh,
Yes,
ah,
on that medication, often
oh,
you have to take the time to drill down to actually find out what's causing that reluctance to take the meds. And often you might find, we don't look about it, but we might find either there's a bowel movement issue, and that usually makes you quite full. If you're not moving much, then your bowels are going to be very slow, and you start feeling full even when you drink water. So it's really a terrible circle. So it's very important not to really ask why that reluctance in medication, or they might be having the medication might be making them feel funny, maybe making them dizzy or making them, so it's very important not to just force medication down people's throat, but to ask them, sit down with them and have that candid discussion to find out why or what is causing this reluctance, especially with medication.
Also, we have loss of appetite and memory loss, then also not wanting to take their bath.
Yes. Hopefully by the end of this session, when we compile all this, we can then, once the video is posted, we will then post these activities and the discussions, suggestions at the end for other people to see. I'll go on to the second learning objective or key discussion today is really the core principles of elderly care. I put down this UK care certificate because most of the information I give is around the standards that I'm used to working in. I mean, the UK care certificates are internationally recognized guidelines that focus on high quality caregiving practice. Okay. These include things like safeguarding, as in keeping the elderly or vulnerable person safe, communication skill, hygiene, infection control, and respecting an individual's dignity. These principles can also be applied and is applied in Nigeria, particularly for professional and family caregivers. You find if you hire professional caregivers or even the Nursing and Registry of Nigeria, you find that the principles both in UK and Nigeria are similar. So the key principles of elderly care, we have three key principles, which is dignity and respect. Okay, the elderly must be treated with honor and respect, even when they require assistance. We mustn't ever make them feel like a burden. Empathy and patience. Caregiving requires an understanding of their struggles and providing emotional support. Very important. And encouraging independence. Whenever possible, allow the elderly to do things on their own to maintain their confidence and mobility. I know sometimes it's very easy and it's quicker for us to do things for people we may consider to be too slow. But that also knocks their confidence down. So it's very important we give them time, give that person time to do what they need to do and can do for themselves. Hygiene, nutrition, and medication adherence are essential practices. So caregivers must help maintain proper hygiene. So by maintaining proper hygiene, we're looking at bathing, oral care, and grooming. Nutritious meals should be provided considering dietary restrictions like diabetes friendly or soft foods for those with dental problems. Medication management also involves reminding elderly people to take prescribed medication on time to ensure they are stored safely. Part of the things we do in the organization, Eoon Care, is that medication management. Because when medication is not managed properly, it leads to other long-term problems. It leads to condition that is not managed properly. Abuse can be severe. Home safety is also another key key issue around the elderly person, because we're looking at falls prevention here. As we get older, our gait is not so strong. We're easily, a little pebble, a little stone on the floor can easily trip us. So it's important in our homes that we're looking at how can we make this person safe. We have to prevent falls. We have to remove things like carpets and rugs. I know in many homes, there's always a carpet and a rug. It might be fashionable, but it's a very high risk of tripping on those carpets and rugs. So if possible, you might install handrails and grab rails around the stairs or in toilets, for example, and ensure good lighting to reduce the risk of accidents. To also practice, give this essential practice, it's important to have emergency contact details of anybody you're looking after. You have to have emergency contact details of their relatives and medical practitioner in case of an emergency. Where should you go to? Where should it be the first person you contact to say, hey, grandma or grandpa is having issues? Train family members, if possible, with the basic first aids training, just the basic, what to do in an emergency if whatever the situation is. For this, it's very important that we look into a kind of case study. I would like us to really look into it. This is a case study which is all about fall prevention and caring for somebody with their dignity and respect, which sometimes can be blurred in our society. So I have a case study here from a lady. Mrs. Adiola is an 82-year-old retired school teacher living in Lagos. She has arthritis and mild osteoporosis, which makes it difficult for her to move around without assistance. She often experiences joint pain, stiffness, difficulty standing up from a seated position. Her daughter, Ifeoma, works full-time and has hired a caregiver, John, to assist her mother at home. However, Mrs. Adiola values her independence and sometimes refuses help, saying, I don't want to be treated like a child. One evening, while trying to walk from the bedroom to the bathroom, Mrs. Adiola trips over a rug and falls, injuring her hip. She is shaken but avoids a major fracture. After this incident, Ifeoma and John realized they must make changes to improve safety at home while respecting Mrs. Adiola's dignity. So the question here is, I would like you to think about what safety measures can be taken at home and how can a caregiver provide support while preserving dignity. Again, you could write it in the chat, Mimi, if you could read them out, or you could raise your hands. We have about a minute.
Someone said removal of the rug.
Yes, fantastic. Yes, on my list here, the first thing for prevention and home modification, the first thing I have is that remove tripping hazards. Yes, yes, yes. Thank you. So loose rugs, cables, clutter are removed to create clear pathways. And again, as I mentioned previously, you can install those grab rails or handlebars that will help. You can improve the lighting, exactly as mentioned in the chat, non-slip mats, and the footwear very important to look at the footwear. We're all very keen to wear slippers at home, but when you're frail and mobility is an issue, slippers might not be the best footwear to avoid falls. Also support movement and improve light on the way. Yes, thank you, Eris. As well, you can introduce a walking aid. Yes, thank you. Change bathroom style to sitting style, yes. So for mobility assistance, you can
Nene, you're muted. Please.
apologies. Apologies. Apologies, yes. Sorry, where are we now? Yes. Apologies. So mobility assistance, to introduce a walking aid, adjust furniture heights. I think someone has already mentioned that. Use a raised toilet seat if possible. For emergency preparedness, okay, we don't often think of it, but we need to think when you're looking after a senior citizen, elderly person, vulnerable people, you need to be able to think ahead. What happens in an emergency? Even if it's me, who should the person looking after me contact? That's what I would ask myself. Who should my carer contact in an emergency? It's very important. That's why we recommend having a care plan. Very important. So you must have a mobile phone ready to dial with credits, preferably, and any doctors, family doctors that can come to your aid. So in terms of providing that dignity for her, we need to encourage independence for Mrs. Adiola, because in as much as she's had a fall and she's 82, her gait might not be as strong as it used to be. Instead of doing everything for her, John needs to encourage her to do as little as she can for herself. That is the bottom line. She needs to be encouraged. And always ask the question, would you like me to help you? How would you like me to support you? Can I help you with this? Don't make the assumption. Give time for them to be able to do as much as or as little for themselves. Try to use positive and respectful communication. So instead of saying you can't do this on your own, you encourage them. Let's work together. I know you want to do this on your own, but let me support you in doing this. So also with assistance for personal care while maintaining privacy. So when helping with bathing and dressing, John should provide towels and bathrobes to cover her body between steps. Okay, it's not fair to leave anybody in nude, especially with the opposite. That's why people often want to get a caregiver that is same sex. It only makes sense. None of us would like to be none of us would like to be in that position. So always use verbal cues like I will hand you the towel, you can dry yourself. Just allow her to do as much or as little as she can for herself. That's the bottom line for her. So supporting Mrs. Yogdiola, the key lessons in the case study will be safety at home to reduce the risk of falls and injury for any elderly person or vulnerable person. Dignity and independence must always be respected. A caregiver's role, remember, is to assist and not take over, allowing people to remain as independent as possible. And proper communication Home modification, as you've written in the chats, and encouragement can improve an elderly person's quality of life. Before we start communication, does anybody have any other suggestions or something to share for the dignity or the falls? Okay. I'll go straight on to effective communication. So effective communication and mental health support is very, very big in our community. For effective communication with elderly people, with vulnerable people, we need to speak clearly and slowly, making sure they understand, and use non-verbal cues like nodding your head and smiling to make them feel comfortable. If they have hearing difficulties, ensure that they use their lips. They can see your lips while you're talking. So don't back people, because one, the eyesight is going and the hearing is going at the same time. So come as close as possible to them to speak to them slowly. Show patience and understanding, as they can take longer to express themselves. So recognizing mental health in elderly, many older adults experience depression, anxiety, and feeling of loneliness, especially if they live alone. Bearing in mind, many people have had a fulfilling life. They've been have beautiful careers in their lifetime. They've had a house full of children and families. Then all of a sudden, in their twilight years, they see themselves all alone. So it's very easy to start becoming depressed. It doesn't come with a banner. It just happens gradually. So signs of depressions could include the loss of appetite, mood swings, withdrawal from activities, and persistent sadness. So it's important that we're able to recognize this these signs in the people that we're caring for, or even in ourselves, and then we'll be able to talk to somebody within the field to support. So one of the things that can happen is that social engagement and interaction and mental stimulation is very important for games and puzzles that will help keep the brain active and prevent that cognitive decline. Just like the Berachah Care Community Center, that's brilliant. Even if it's just once a week, it's a fantastic and engaging atmosphere for everyone. That arts and crafts, storytelling and music brings emotional support and a sense of belonging. Also, regular outings or social groups meeting improve mental well-being and prevent isolation. So it's very, very important that we are able to identify a mental health or depression. Okay, it's very important we can communicate effectively with people in this part of their life. I would say that. So activity number 3 is about communicating with an elderly. Can we share any experience of challenges you may have faced, either you communicating or being communicated to? Again, you could write it in the chat or you could put your hands up. Yes, Mimi, I see your hands up.
Yes. I go back to how I was able to deal with communication with my mom. I told you earlier on that she was quite elderly, and over the years, because we were not in the same city, so the phone communication was one of the ways we used to communicate with her. And so I found out that over time, even the phone conversations, I couldn't meet up because my work has been stressful for like, I've been in top management for like 20 years. And so I just come back and I'm always so tired. So what I started doing was I used to get my children to call her and ask her how she was doing. And I remember one time I told my second daughter to call her. When she was done, my daughter told me, do you know what Granny said? Granny said, thank you for remembering me, sweetie. So when my second daughter told me that, in fact, I was tearing up because I realized that I should have done that, but I just couldn't. I just found myself always just so busy. I really feel bad about it, but I did my best. So that was one thing I tried to do to make up for the lack of communication. And then by extrapolation, my mom had glaucoma with the complications. So her sight was very poorly towards the end. And so, at one point she said she's not really bothered because she had a very full life, had a wonderful career. So she said, is there anything I haven't seen in my life before that I need to see now? So she kind of came to terms with it. But the communication she got, because she was like the mommy of the town, anybody that them, they will come to talk to her, and each time she resolves the problem, she says she feels useful. She's happy that people still consider her somebody that she's useful, is useful to the society. But I remember when my brother and we combined resources to renovate her apartment. It's the family home actually where my father and her lived until my father passed and so on. So, well, we had to do some renovations and people were coming, and each time they come, they say, oh, your house is so beautiful. So even though she couldn't see, but that communication, that people were commenting, so as if she could see through their comments. So that opportunity for people to communicate a positive thing, it helped her a lot. And also even in the issue of gifts, like whenever I travel, I buy things and so on. And she had sisters in Lagos, and they got to hear that I bought her some designer bags and shoes. And one was this complaint and said, why are you buying things for old people that don't go out? So the whole communication about what was bought for her, even though she couldn't see it, put her in such a good mood, and it gave me some sense of comfort that I did my best for her. So I'm just giving different kinds of communication that we can do, communication to make sure that they are not lonely, communication about their surroundings, even when they have some kind of challenge, it could be physical and so on, they cannot walk and all that, but there are things that you could do, like you go out and tell stories. Oh, something happened somewhere, you come back and relate that story to them. They couldn't go there to see what happened, but because you came back and related that story, that time of communication can boost their mood and help them feel that they have not been left behind.
Yes, indeed. That whole social engagement. Someone said, when hard at hearing, you need to repeat sentence patiently. Yes, indeed, Elizabeth, thank you. That whole engagement, that whole interaction, because from birth, the minute people can walk and talk, it's communicating all the way for a very long time, many years of communicating. And then all of a sudden, you're not communicating as much because you're now very frail and old and left alone. So you can see the link of loneliness and isolation and then depression that comes along. Thank you. Welcome, Cordelia. Welcome. But yes, it's very important that we have effective communication and we speak closely and we speak slowly. And also in terms of recognizing that mental health and providing those mental stimulation, whatever it is, try and put it in your diary once a month to go and take grandma, grandpa out is very important for them. Anybody else? Okay, I'll move on to the next section. This is about record keeping and care planning. as we have said, I mean, record keeping, it says it for, why record keeping really? It's keeping a care diary helps track an elderly person's daily activity, health changes, and medication schedule. I'd mentioned it previously, if you're caring for me, I'd like to put myself in the position, who is the first person you should call if I'm not feeling well? There is a lot of confusion when people are not feeling well, but you should have things in place on the fridge with the person's phone number. In case of emergency, here is A, B, C. These are the steps you should take. It should be in a public environment so people can see what to do if I'm not feeling well. Because there's a lot of confusion. All of a sudden, people are running helter-skelter, not knowing what to do, not knowing who to call. But record keeping, if that diary, that care plan is very, very important. A written record is helpful for family members, doctors, and caregivers to ensure there's a continued care. With Eoon Care, the service we provide, it comes with a care plan. Once you have engaged our services, you will be, we will complete a care plan for you. We want to understand how many times a day you take your medication, and with what do you take your medication? Who is your next of kin in case of anything happens to you? Those simple information. So a basic care plan is really about outlining your daily routine, when you're bathing, dressing, grooming, things like that, meal schedules, because as we get older, our appetite shrinks, and then we have very sensitive requests for menus. So it's very important to plan the meal for that person. They don't really eat mountains of food, but the food they do want to eat or need to eat has to be very nutrition dense, very, very nutrition dense food. So medication reminders, when is the prescription due? And we should always have a habit once every year at least to go and have your medication reviewed by a registered pharmacist, because sometimes we are our own challenges, because you find you're taking medications that are prescribed, that are not prescribed, and some of them can have interactions. So it's very important that we are mindful of the medications that we're taking. And saying of medications, I will tell you a brief story. We once had a client who was on antibiotics, and they gave it to her endlessly until we took on her care. We always get your medication reviewed by a pharmacist, and the pharmacist pointed out that this antibiotic was supposed to be a one-off, and who knows how long the lady was taking it repeatedly. So if there's one thing you take away today, go and have your medications reviewed, or go and review the medication of your loved ones. Exercise and social activities, that's also will be written on the care plan to see what you enjoy doing. People assume because this person is older and frailer that they just want to sit at home all day doing nothing. No, it's about finding out what interests them, what are they passionate about, what do they enjoy doing. So you can use simple tools, health tools to track and document, care diaries. Smartphones nowadays are tracking. If you have a smartwatch to count your steps, for example, and reminders on how to take your medication. In Nigeria, basic notepads and printed templates are often affordable, so you could get that anywhere. To help you record and keep a record and map and track the care that you're receiving or the care that you're giving. So activity number 4 is about filling out a care plan, but really what should be included in a care plan is what I've just gone through. The question now is, have any of you, had a care plan either for yourself or somebody else? Or have you ever seen a care plan before? Any hands? So perhaps after today, one of the things, no, many people are saying no, well, I guess the thing is, if you put yourself in this situation, if you have a carer that comes in to care for you in an emergency that anything happens to you, who do they call? Is it very straightforward? You see, because often it's always when there's an emergency that we realize how disorganized our care has been. So it's always nice to think ahead. I'm happy to share a template later in terms of the care plan, but it's always nice to think ahead and write in an emergency, daughter or son or church or pastor, who do they call? Who do they call in an emergency? Okay. Okay. Now let's address one or two of the challenges in elderly care, home care. I think the key one is something that always comes to my mind is this whole abuse and fraud that elderly people all of a sudden are very are targeted. They're often targeted. Elderly persons are often victims of financial crime, physical neglect, emotional abuse, and we can actually identify when somebody is being abused. Some of the warning signs actually are unexplained injuries or bruises, sudden withdrawal from social activities or engagement. We've mentioned that earlier. Sometimes missing personal belongings, money disappearing from accounts. Caregivers should report suspicious behavior to family members or anybody they can trust, and vice versa. If family members are seeing these behaviors, they should be able to take action and not assume that mama is always complaining of her money missing. Maybe mama is right, that her money is getting missing. Sometimes we need to look into this more. Does anybody here have an example or have experienced any form of fraud targeted at the elderly or any kind of abuse? No? Okay. A few weeks ago, I had a call from Lagos. One of our clients, the son is a retired doctor. He's in his 80s, and they do have a caregiver. And the son walked in on the caregiver, actually abusing the dad. Oh, fantastic. Vivian, your hand's raised.
Yeah, good evening. So, good evening, everyone. Yeah, I think recently, that should be in February, precisely late January, my parents, because they are living alone now, we had somebody that is taking care of my mom because she has fracture. The money she was keeping, because she had some little business she's doing at home to keep her busy. If she keeps the money, I want to go to the markets, like about 200,000 before she comes back. You see the money will turn to 100,000. And she'll be calling us. I don't know what is happening to my money. I mean, is this spiritual money that are giving to me? That the money will just disappear. That her customers are using spiritual money for her. So we're kind of saying her talk just to calm her down so that she will not be so tensed. Later, she ordered for some business. The requesting for money to replace the one that was stolen. Only for after the next day, the money was also missing, 50,000 from that same money. So we're telling her, Mom, are you sure it's not the person that is taking care of you that is doing this? He said, no, God forbid. There is evil money. They're giving her evil money. Because if her fear was, if this person needs her to go because you so much trust the person, who will be there for her? So, but we're trying to tell her that money cannot be missing, even though it's spiritual money, cannot be missing in bundle. Even my brother had to call and say, that spirit is a very caring spirit. Oh. They will not take big, they will just take small from your money and leave the rest for you again. So what we did, just to find out, was one day she was sleeping. We had to send somebody, a family friend, because if we were to come to query that person personally, she will not allow us because we are not there. We are not there at home with her. That lady is always there with her. She doesn't want anything to raise an issue against her. So we just sent somebody, we called somebody to go to the house, please. Help us talk to this person who is taking that money in 100, in 50s. So we sent a security officer there. So when she saw the security officer, she was scared. It was then started confessing that she has been the one that has been taking the money from her, that she has the spare key of her room also. She goes there, she collects what she wants to collect and locked it. It was only when she woke up from the bed, she now saw people in her house, she started crying, that she never believed that the caregiver could do such a thing to her. And that was how we had to send that person home. So actually they are fraud, and mostly when they depend solely on that caregiver, and you see, they use them. They try to take what they are belonging from them. You understand? So that was the experience we had. Thank you.
Thank you for that brilliant example. Thank you. Orenike, I see your hand.
Yes, just a very short example. I think I was with my mom when she was elderly, and then I just noticed two small boys, they come around to come and cut the grass. So they were telling her that she had not paid them. And then she was wondering, she has not paid. She was going to come into the house to go pay them. And then I looked at my mom, you don't owe people. That's unusual. Why wouldn't you have paid them? But I think they were exploiting the fact that, our memory isn't doing so well. So when we got to them, they had to leave because it was a lie. They hadn't even cut the grass. They just wanted to exploit our memory and that she couldn't remember things. So I think it happens actually a lot. But that was one where I walked into the situation. I had to handle. Thank you. Over.
Thank you so much. Thank you. And it happens and it's growing in our communities. We don't want to admit it, but we're in the crux of it now. Our elderly are being exploited heavily, especially by people you trust, because often abuse is often by the people you trust. And the caregivers, when people are living in your space, they become your family, and you trust them, 100%. So it's always the best practical things, even if you have a caregiver looking after your loved one, is to always have some time on your own with your loved one. There is no point calling them to say, Mama, is everything all right? And they're there in the danger of the caregiver. They're going to obviously say, yes, everything is all right, my child. So it's important for you, even if I don't know how often, how far away you are, but you need to take Mama out of that her environment on your own one-to-one and let her confide in you. And you should be able to notice of any changes in Mama's behavior. Because it's happening even to the best of everybody. It's happening now because that's the society we're living in. Any other examples? Okay, if I just move on to the caregiver stress. Yes, go ahead. Who's speaking?
It's Cordelia.
Okay, go ahead.
The experience I have was, when I was a carer in London. So the men, they are in deployment to care for elderly. So some of the men, they lack patient. So when they are caring for these people, especially those who are dementia, when they tell them to do something, either if they are feeding them or they are bathing them, instead of them to gradually bath them or feed them, they will be slapping them. So they didn't know that they put CCTV there. And once they slap them, heavy slap, not even small, until one day they play the CCTV, they expose their activity and they start those men. That is why it's good when you employ a caregiver, you try and put, if you have money, you put CCTV to see what they are doing to those people. And they will warn them not to tell anybody. That if they tell anybody, they will see them.
Yes.
And that is showing the cases we experienced there. And we couldn't believe it that the Igbo people, our men, can do that.
It's in every society, unfortunately, to have people who have that type of mindset, unfortunately. And that's why we have to keep an eye and care for our elderly. Mimi, I saw your question before it disappeared about caregivers. That's one of the things Eoon Care is doing, is to create a verified list of registered caregivers. So we're getting a register of caregivers in Nigeria, where we actually go to verify you, almost like what they do in the UK, where everybody has a DBS and police record. Yes, we go into your homes. We want to understand where you're coming from, even when you're recommended. But it's a baby steps at the moment, because 36 states or so in Nigeria, it's a huge task. But yes, it's possible. It's possible. Mimi, would you like to add anything to that comment?
No, your answer is sufficient. Thank you.
Okay, thank you. Okay. Okay, so we're on to now managing caregiver stress and burnout, because just talking about abuse and financial fraud, it goes in nicely with a burnout, because when you entrust a caregiver or your parents or family member into the hands of a caregiver, often, always, sometimes a stranger, we then forget about the parents. We then go off, and it's very hard work. Caregiving is a chore. It's very hard work. And often people are not doing it because they are passionate about it. People are doing it because it's the only option they have. Think about that. So they're not doing it out of the goodness of their heart. They're doing it because they need an income, and this is what they need to do. So you have to understand, caregivers are human beings too. Okay? And caring for example, a woman or a man or a human being who has a dementia, where you're constantly, as a human being, on top of that person, directing, coaching, removing, guiding, talking, it's tasking, and it's very, very exhausting. And more often than what we see when abuse starts happening is because that caregiver is tired and they don't have any choice. They don't have any relief. That's why when you are getting a caregiver, it's always good to have one on, one off. One on, one off. Try not to keep that same person there for 6 months. Try and rotate them so that person can go and have a break. That is just one of the key ways and key strategies to manage this burnout that sometimes translates into abusing the person that they're caring for. So caregivers can be physically, emotionally exhausted. So signs of burnout is that fatigue, that irritability, the caregiver I'm talking about, that depression, and that frustration. So to avoid it, like I've suggested, you just try and have that regular breaks. If they are living caregivers, then you're going to be looking at rota. So you rotate them. You can have 2 weeks on, 2 weeks off, 2 weeks on, 2 weeks off. When they're off on their leave, the other caregiver steps in. that is how we tend to practice caregiving, because caring for somebody 24 hours a day, 7 days a week is very tasking. So at Eoon Care, we do have a caregiver support, but obviously the best thing to do is that rotating the care among caregivers, using an agency is very advisable, so that you don't have to go through the thing of looking for a caregiver. You can just call the agency up and they will send you somebody else while that person is on break. And as well, it breaks that chain of familiarity and that whole abuse going on. Yes, you give them a break. Any more comments on this? We are skipping through this very, very fast. I think, believe it or not, we're coming to the end of this at the moment. So if I can recap, if there's nothing anybody wants to raise, if I can just recap on the key lessons so far, key takeaways. So we talked about understanding elderly needs at the beginning. So their needs in terms of physical, mental, emotional challenges they may face, and common issues like the mobility challenges, the memory loss, and isolation. We looked at the principles of quality elderly care, which is about that whole dignity, respect, and patient-centered care, that whole independence. A caregiver is really there to support and not to do everything for them. We also looked at their whole hygiene, nutrition, and medication management. We looked at effective communication and mental health support, how we should be talking very slowly, very kindly, and very demure to them. And also how to watch for signs of depression and anxiety amongst the elderly, and also dementia. Somebody wrote in the chat about repeating sentences. That is a clear sign of dementia. If that person is constantly repeating themselves, something is going on. Also trying to engage them in social activity, which will stimulate them. Even if it's once a week, once a month, but it's nice to have a plan. If you have a care plan in place, then you're able to plan their care. Preventing falls and what to do with carpets and rugs and handrails at home. We talked about record keeping, and again, the care plan, and making notes. You can just get an exercise book and make notes. It's very important. If one thing you take away today is having a one-page care plan in an emergency, who should this person contact on my behalf? And also preventing abuse and caregiver stress, which is all about, the abuse is all about signs of financial scam, neglect, physical abuse. Caregivers should take a break, seek support, and manage stress to avoid burnout. So finally, I mean, caring for elderly or senior citizens or vulnerable people is not just about meeting their physical needs. It's also about giving them that dignity, that love, and that respect in their golden years, especially with senior citizens. It's a blessing that we have for them, and it will also lead to them living very long and very happy. We have a couple of resources. I think we'll post them. Mimi, I think you were going to get the downloads, weren't you?
Yes, I will get the downloads, and I'm also going to circulate the slides along with the YouTube link.
Fantastic.
Yeah.
Fantastic. Flora is going to post a few links in the chat. So when you're editing your video, you can also attach it to the YouTube channel.
In
Yes.
the YouTube section.
Yeah.
Yes.
Yeah. But there is a blog. I will encourage people to subscribe to the blog. The blog writes on many topics in on elderly care. It's specific for elderly care. The link will be, it's here. We have, and this training is a very, very, very basic training. It's not the type we give to caregivers, which is more in depth and dense. This is very, so that you have an understanding of the type of care to expect and the type of care to give. We also have training on dementia, amongst every other training that we do. I'm not sure when the next session is going to be, Mimi, if we're going to have another one.
Oh, it all depends. You know, like I told you, when we post some of these webinars on the YouTube, we get a lot of views. The one we did on aging tips for
Yeah.
the aging, or aging in healthy, aging healthy by Dr. Ogugwa Osiogbo of National Hospital, Abuja. We got over 450 views. So
Okay.
people will be, you know, depending on the feedback, we'll now know
Yes.
what area. But the truth is, this particular training session, as basic as it is, should have cost something. If you had, if we are charged in pounds, I'm sure it will not be anything less than 20 pounds. And if you charge in naira, you know, given the exchange rate and everything, anything from 20,000 or so. But there is a reason we have done it free. Why? Because in Nigeria, the caregiving is not systematic and it's not standardized like you have in the developed countries. I know the developed countries has their database of all those who are in the elderly group. Once you have your record, your social security and everything, once you get to 60, all the resources will just be made available to you. Free transport, free this, subsidize that. And if you get to the point where you need to be, I have a caregiver, I don't know how it works, but I know of people who either are in care homes or they have caregivers that visit them at times and so on. Whatever, it's like it's automatic, but here it's not.
Yes.
And so what is that person from the rural area or wherever that comes, that doesn't really know anything, doesn't have any health background, that person comes. If you now go and do the detailed training that costs 200,000, 250,000, whatever, and then in another 1-2 months, the person goes away, it will be demoralizing to train a second person. So the turnover givers is so high. That's why our organizations collaborated to make this basic one available free so that people can use it. A lot of people are learning a lot on YouTube now. People are learning how to cook, people are learning how to garden and so on, just on YouTube. So learning caregiving on YouTube too should be one of the things, and this is customized to our Nigerian environment. If you go to YouTube, probably you see for advanced environment, but we've brought this home so that our Nigerian environments, people can use it. So basically, that's the essence. But for further care, where you now look at somebody that has dementia, now you ask yourself, if in Nigeria, I have to get this person admitted, and if I have to pay for a trained caregiver to be taken care of at home, you know that taking care of at home will be cheaper. Because where you even have facilities where they can handle dementia, both the active conditions and other associated conditions, it's going to be hugely expensive. But that is why people should be ready to have the training and pay for the training and so on and so forth. And when you are doing the training, even if you're training somebody, try to participate so that even if that person eventually goes, you can use that training yourself to keep providing care until you get another trained replacement. So that's the reason why all these resources. There's a question about where can we get professional? Is there any curriculum for training professional caregivers? Yes, Professor Ima Obong Ekanem. Thank you so much for joining and asking that question. UBTH has, I know Professor Akoria Obehi, she has established geriatric training. And then I know that there are places in Lagos, and the Dr. Ogugwa Osiogbo that I mentioned, she was one of those there's a national center for senior citizens. She was part of the team that prepared a national curriculum. I know that Professor Belgam in Port Harcourt, she does training too in her own geriatric center. And Federal Medical Center Asaba here, they have just set up Caregivers Academy. So all these places, you can reach out to people you know there and get all the relevant information. And as we get their details, we'll also be circulating them to people and so on, so that people can go for the thorough training. But like I said, some of these trainings are very expensive. And the other is that when you send a caregiver to go and receive that training, unless the person is a relative that has been living in that household, the tendency is that they may leave, and then you now begin to feel that the training has been wasted. Now, one very important aspect of what we are trying to do as we work together to provide a better services for senior citizens is that awareness creation is very, very important. You'll be surprised how much the information that we are sharing, how it now goes back and people go back and begin to reflect and take decisions and make provisions and so on. I wasn't a senior, in fact, I'm not a senior citizen yet. I still have like 2 more years before I can now officially, but my mind has been operating like a senior citizen for like 20 years. So maybe I was born before my time or after my time. I don't know how the saying goes. So the situation now is that I do recall when a colleague of mine said she fell in her bathtub, and I used to love bubble baths a lot. So the bathtub was my friend. I love to soak. When I heard that she fell, I had to move out of a room in our home that had the bathtub to one that just had the shower, because I said, I'm not going to wait until I too fall. Then I now begin to look for rehabilitation and things like that. So we need that awareness creation. And there are some basic things that everybody should know that, look, if this person is staying in a place where, how do you call it now? They have to climb upstairs, and you see the person is getting elderly. You have to say at some point you can no longer stay upstairs, and you insist. Family members should insist. I recollect how sad it was when Mrs. Ivana Trump died. And why did she die? She fell. She fell, and people said that they've always known the beautiful house where she lived. Please, Miss Dr. Could you mute yourself because you're interfering? I'm trying to mute you and it's not working, and you are interfering. Please,
Flora,
Dr.
can you mute it?
I'm trying to mute him. It's not okay. It's finally muted. Sorry about that. So the situation is, when she now fell and she died, one thing, a lot of people made comments that her staircase was like a spiral staircase. A lot of people had complained that this staircase is very, very dangerous and so on. I'm sure she was somewhere around her 70s, just like her former husband, Donald Trump. And that was one. That was the first thing. The family members, with all their wealth and their knowledge and their exposure, should have insisted she does not climb those stairs at her age. One. So that's why we say all this information about safety, everybody should be aware. If we will all have to deal with a senior citizen, if it's not our parents, it's a friend, it's an auntie, and so on. When we are interacting with them, we need to let them and set ground rules. You are no longer going to stay upstairs because of your age. Come downstairs, and that's one. Then two, at her age and her wealth, she did not have a living housekeeper. This issue of senior citizens, at some age, they must have a living. If they cannot have a living, please let them come and live with us. Even if they're not living in the same house, they can live in the same compound. It's allowed. I know we have the biblical principle of leave your father and your mother and all that, but I'm sure there are conditions when the person becomes quite elderly. They should live in the same place where people can be checking on them and be sure that they are okay. Why? Because when she had that fall, we don't know how long she lay. Maybe she had a hip fracture, or she had a fracture, and so she couldn't move. She couldn't reach her phone to call for help. She stayed there and probably bled to death, whatever. I'm not sure there was an autopsy to find out what the cause of death was until the next day when her day housekeeper came, entered the house and saw the woman dead. That's not the way to die. That's not a good way to die.
And
So
when you have a fall, just to say, Mimi, when you have a fall, the longer you're on the floor, the more you end up dead, if that makes sense. If you can't get up. So she was there for like almost 24 hours, maybe, or more.
12 hours. Let's say it happened at midnight till or maybe 6 p.m. till 6 a.m. the next day. So at some age, no matter how level of independence, there's need for somebody to live in. These are things, if we start talking about it early, by the time comes, it will not sound so strange to somebody that is independent. You know, sounds strange. At some point, you need to stop driving. At some point, you need to stop doing this. Just accept it and thank God that you've had your long run of life where you were gallivanting all over the world. But at a certain age, you now need to know that to be cautioned. And these are ground rules that we should share frequently so that when that time comes, we will have our senior citizens. It won't be so difficult to convince them, and it won't be an issue of dignity. So those are the closing remarks I want to make. Thank you for all the resources. This whole communication will continue in some form, and the places where training is already occurring, we will try to get as much information so that we circulate it in all the various platforms. And you have our contacts. There's a phone number. Preferably, please send text messages. Don't call, because some of us are still very busy in our daytime work, and these are extracurricular activities that we are taking on as our contribution to a better society. So on that note, I want to say thank you, our wonderful facilitator, Nene. Thank you for Flora, who has been helping with the IT and the resource sharing. And thank you all our participants for attending. But before we go, I don't know if Dr. Shitu, she's there. She is the M1. M1 is Medical Women's Association of Nigeria. She's the coordinator of the Senior Members Forum of M1. I do not know if she can just say a few words before we end the meeting. Dr. Shitu, are you there? Are you still there? Can you unmute? Okay. And then my own Professor Asuzu, my personal professor of public health physicians, I saw him at some point. Professor Asuzu, could you just say a few words if you're still here? You're still here, Prof. I can see you. And Esther, you're still here. Okay.
Yes, I'm still here, struggling to open this phone properly. I've been very happy to listen to all of that. You people know I belong to the category you are talking now. And it's good to share all the knowledge you have shared. Mwan, please carry on. I'm meaning him. Continue to blow hot. Eh? Thank you all very much. Bye-bye.
Thank you so much, Prof. That's fine. You want to say something? Dr. Esther? Okay. Okay, maybe she's away from her device for a short while. All right. So we want to thank you all for being here. We actually kept to our time. We are just 1 minute to 90 minutes from the time we started. So I think we have done very, very well with our time. And the most important thing is we can do a lot to make Nigeria better. Please don't be in the group that just complain. Just talk. Just forward. Okay.
No problem.
You're free now. Please go ahead, Dr. Esther.
Those ones. Yes. Okay.
Dr. Esther, we are not hearing you. Are you speaking?
Okay, not particularly. Good evening, everybody. And it's been a pleasure listening to all that has transpired. And it's quite enlightening. And I'm happy I was able to attend and listen to most of the discussions. I learned a lot for myself as well. And I'm going to make changes in my own lifestyle, as well as advise other elderly people to begin to implement some of the things that have been discussed, you know. Thank you so much.
Thank you so much, Ma. It's really a pleasure to have you. And thank you for the good work you are doing with the M1 Senior Members Forum. So that's at exactly 90 minutes, we are signing off. We're going to leave the room open for just 5 minutes so that people who want to copy the links and so on can do so. Thank you all and God bless. Bye-bye.
Bye. I didn't know they had been calling me, so I just told myself that.
Hello, Ma. Are we through with? Okay, what was?
I'm just waiting for 2 minutes and then I'm going to end. I'm just waiting because some people may want to copy the links that were shared.
Okay, Ma.